Good morning. It's really a pleasure to be here, and I appreciate the first two presenters' presentations because I think it naturally leads into some of the themes that I want to raise today and hopefully open up for discussion later. So I'm going to talk a little bit about some work that RAND has been doing with the city of Santa Monica in California to reimagine the role of cities at the governmental level, at the decision-making level, as really changing the orientation of cities to produce health and well-being. And this is, I think, kind of leading off from Commissioner Farley's discussion about reimagining the purpose of the solutions that we have for social determinants of health, but also thinking about it in the context of what we measure, because as we know, what we measure is often what matters and where we put our resources. So let me just set a little bit of context with where this work sits in the broader conversation that we're having about health, not only in the urban health context, but in the broader health discussion. And so you heard Commissioner Farley talk a little bit about social determinants of health. You know, we really see that there are 4 trends in health that are aligning, which is also where cities are thinking going ahead. One is that we've been talking for years about health in all policies. We're kind of moving to a conversation about health in all decisions. So that's very important in how we think about policy design and implementation, but even the lens that we put into place earlier in the thought process before policies are articulated and implemented, how are we actually talking about health? What's the narrative about health at every community convening and every community discussion? We're also seeing a greater well-being focus. You heard earlier discussions about a more holistic representation, a greater appreciation of the WHO definition. That's 70 plus years old, but yet in the US, we're still making only incremental changes towards that orientation. You're seeing a stronger focus on not just gap closing with respect to disparities, but equity, which really means a conversation about structural and historical drivers of health and well-being. And then finally, you're seeing a lot of discussion about integration of health investments, right? And so we heard from Commissioner Farley and some of the questions, how do we think about engaging non-traditional sectors in health? What is their role? So much of health is driven outside of what a public health department does and what medical care does. How do we actually think about those things together? So it's in this context that rather than just thinking about how we reduce disease and reduce morbidity and make sure that we don't have the tobacco-related, the alcohol-related, and other kind of social and environmental drivers of disease, that we actually look at what produces health. And it's in that context of what produces health that the role of cities is changing and transforming radically. And health is just but one path that communities are reimagining their purpose. They're trying to be more holistic in how government agencies are working together and how government is working with NGO, and they're trying to think about being more asset promoting. Now, in those of you who do community-based participatory health, we've been talking about this for a long time in terms of an assets framework, but how that gets integrated in the hard work of local policy and local government is easier said than done. So let me talk briefly about the role of local government in this idea of the Santa Monica Project, which in many ways is part of a global movement on how to think about integrating well-being into the business of government. So let me start with a little bit of a story, unless you think that this whole panel has been underwritten by Bloomberg. This project is also partially funded by Bloomberg, but it actually has a bit more of an origin story. So Santa Monica, many of you think of as this beautiful city on the beach. RAND has its corporate headquarters there, and it's true. But actually, Santa Monica is a community that's grappling with many of the issues that communities across the U.S. and globally are dealing with. Racial ethnic equity issues, income disparity, housing affordability, certainly climate change and environmental sustainability issues, immigration, and the like. And Santa Monica was also grappling with the idea that they were not the beacon on the beach that they thought they were, that they actually had those issues. And as is often the case, cities transform not just in recognition of chronic issues, but in recognition of acute events. And Santa Monica had a couple of events that preceded the opportunity of the Mayor's Challenge that galvanized a small one-sector conversation into a broader community effort. And that was really twofold, and it was in the space of social connection, cohesion, and mental health. They had a high-profile mass shooting at the community college in Santa Monica, and they also had a high-profile suicide of a young person. And it really shook the city to its core, and they said, look, we can go about our business investing one sector at a time, or we can actually transform the way that we think about our business and our role of city government. And at that time, Mayor Bloomberg was innovating in terms of his and his team's investment in cities. And the city of Santa Monica partnered with RAND and the New Economics Foundation in the UK to try and think about applying for this opportunity. Now, as you can see, Santa Monica was one of the first of the 5 awardees back in 2013. But the vision of Santa Monica was very different than the other 4 communities, which are wonderful projects, but again, very single sector focused. And Santa Monica was sort of the little engine that said, no, we're just going to rewrite the entire playbook and transform what our purpose is as a city government. Can we embed essentially a well-being orientation and a well-being framework into everything that we do? And to our surprise, Santa Monica was selected, but again, it was still a conceptually difficult and messy project. And one of the reasons that they were interested in this was not just to try and get the well-being idea into policies and programs, but to start thinking beyond how we think about economic productivity, mostly typified by GDP, local revenue, and other metrics. This is part of a global conversation post-GDP to start thinking about if we actually value people, how do we value it in our measures? And if we're trying to be an innovative and creative economy, how do we integrate it into what we actually track and value as a city? Now, there had been well-being frameworks in the past, the Canadian Index of Well-being, certainly the Gallup poll in the U.S. is looking at issues of subjective well-being, but all of this essentially fell short. It didn't really integrate with the government business, the science of government, and the issues of local policy, the legal and the political feasibility issues that you heard Commissioner Farley talk about. There wasn't a coordination around a common well-being agenda, and it wasn't linked to anything. So yes, you could measure well-being, but how do you integrate that into the business of budgeting and resource allocation? So we set about working on a project that had 3 phases, define, measure, act, as you might do in most public health and other kinds of projects. But one of the things that was a hallmark of this effort was that we had the end use at the very beginning of our consideration. This wasn't just a measurement for navel-gazing kind of exercise. This was really about how we're going to take this information and use it to drive a change in the role of cities. So this effort was actually more collaborative than just RAND and the New Economics Foundation with the City of Santa Monica. It incorporated global experts from many walks of life and many different kinds of nonprofits, government, and research organizations. And our goal there was to say, once and for all, let's not fool around with, once again, another framework, but let's actually think about what is the priority set of dimensions that a city can care about, what's actually going to be useful for a city in terms of planning and resource allocation, and what has the potential for scalability and transferability to other communities. And so this is what we came up with, which is essentially a 5-dimension framework, which is represented at the top, to look at the dimensions of community, place and planet, lifelong learning, health, and economic opportunity. And the goal of this was to think of ways that actually city government can influence and has levers for change, and to think about subdimensions, which are identified under each of these dimensions, that not only can be used in Santa Monica, but are easily transferable to other communities. And our goal here was not only to create something for the city, but something that had the ability to transport and be ported, and yet was flexible enough for people to assign their own measures and their own data frameworks to actually tracking. One of the challenges in measurement work, as many of you know, is that it can't be one size fits all. People have different data sources. People have different inputs that they care about. So how do you create a framework that people don't have to recreate, but actually measures that are kind of flexible? And so we were able to pull in data, not only from survey data, which a lot of the well-being work does, but to actually tie it to administrative data that cities already collect, or could collect, as well as social and social media data. So I'll just run through this really quickly. One of the things that we were interested in is ultimately how are people doing? We know that issues of autonomy, optimism, feelings of hope are actually related to economic productivity and health outcomes, and sample measures like this are absolutely critical in terms of resilience, feelings of happiness, and satisfaction. So for example, we know that social connection, emotion, sense of stress, anxiety are absolutely critical for some of the things that we're now seeing as a country in terms of deaths of despair, and yet we weren't tracking it as a city, much less as a nation. We looked at things that we could pull in from social media data. So aspects of the emotional state of individuals and communities matter, and we're able to track that against neighborhoods in the community and do something about it. We also looked at aspects of community. Again, something a city doesn't usually collect on its residents and on its neighborhoods, but it's absolutely essential in terms of health outputs and well-being outputs broadly. And so, for example, Santa Monica prided itself on a great neighborhood feel, but when we actually did the survey and we pulled in social media data, they were falling short from a national survey. So data like this served to disrupt the conversation in Santa Monica and change the narrative in terms of what city government then planned to do. Santa Monica also prides itself on a high voting rate, and it certainly has one. And yet people didn't feel connected. We know that health and well-being is related to civic engagement and participatory democracy, and yet we were seeing places and gaps. Again, an area that cities don't usually track. We looked at, of course, the built and the physical and the natural environment and made sure that that was embedded in the ways that we thought about not only the city planning, but also perceptions of the city. We looked at issues of lifelong learning, something that the city hadn't looked at before. We know that cities track educational achievement, but they don't always look at what are they creating as opportunities for nurturing and cultivating learning across the lifespan. Again, absolutely critical for health and well-being. We certainly looked at the classic health outcomes that you might expect, but we were really focused on things that the city was doing to actively invest in health-producing amenities. Not simply things that were detracting from health, but what were they actively, quantifiably doing in this space? And then finally, we looked at issues of economic opportunity. What were the investments? What was the affordability? But also, what are those issues of economic security that, again, we know are related to health? This was not something that the city of Santa Monica had been tracking. And so what did we learn from all of this for local government? Well, first and foremost, this has been part of their framework. Now it is the framework that they use for performance management for the city. It's part of budgeting, so every city department has to indicate how they are addressing the dimensions of well-being via the framework. They are thinking about it in terms of downtown community plans, sustainability plans. Everything that cities have the responsibility over has to have this overlay. And so rather than just thinking about are we filling potholes in the city, which is important, are we filling permits in the city, which is important, we're also thinking about what are we actually doing to produce and promote health? What is that additional thing that we're doing beyond GDP? And there's some key insights from some of this work that's relevant for local government. One of the things that we did that we spent as much time on in terms of measurement frameworks was actually transforming data culture. What cities often capture in terms of data tracking is actually not that useful. Ask a city what they're collecting. They'll say that they're collecting information on permits given. They'll collect information on maybe programs delivered, but actually ask them what is the well-being of their residents, and they do fall short. And so we had to work with the city to think differently about the measures, think differently about the data, and in some cases throw out a lot of what they are collecting. And so that is a very transformative aspect of this kind of project because it questions what cities are actually doing in terms of their choices and their data and metrics. And they're so bound to those data and metrics that it often drives them in wrong or incorrect directions. We certainly talked a lot about the narrative around well-being, and to talk about health in the context of a more holistic frame is unfortunately still transformative in most cities around the U.S. And so we did creative things, which I won't show today just in the interest of time, but in terms of working with design students and others, media outlets and others, to create a new narrative around health. We definitely talked about this as primary. Sometimes health conversations become secondary in the sort of local discourse. And so it is important to tie it to economics and sustainability and other things that people tend to list as higher. But it is not something that should be subsumed such that it becomes a relegated conversation. And this was something that has taken several years to do, but if people are interested, and I can share more about that. Again, we do a lot of work to create wins, innovation wins, just like you heard in the last presentation, to get the community on board with these kinds of well-being investments. And then finally, working in new ways with non-traditional partners. That's absolutely essential to these kinds of efforts, and it takes public health and health leaders way out of their comfort zone, but it is possible. If you want to have more information about the project, I do commend you to look at the website because there are tools, there are videos, and other things there that you might find valuable. Thank you.